Do eonkene mine atuboni. Do eonyala mine atuboni. Tumo ide amo ide mazuje. Da semi vavali yo ide mazuje. Indo eonyala mine atubono. Indo eonyala mine atuboni. Indo eonyala mine atuboni. Tumo ide amo ide mazuje.
Some of our patients are very, very poor, and to find just 200 naira or 300 naira to transport themselves to the center and collect their drugs, they cannot afford it. That's talking about the antiretroviral drugs. Those are the drugs that are free. Antibiotics, anti-diarrhea, multivitamins, antioxidants, they have to pay for them. NASCAP does not supply those drugs, even though they said in quotes, drugs for opportunistic infections, that they have them. I don't know how many times we have received these other drugs. And a patient that is having diarrhea, a patient that is having pneumonia, a patient that is, secondary infection, he has very good.
They had it.
That is why I said that we should belong to PEFA, and I'm making a case for the hospital and for the federal medical centers. Our PEFA should please come and help us, because our patients need these supportive drugs and these antibiotics, drugs for opportunistic infections. We cannot even make the diagnosis of some opportunistic infection because we don't even have the reagents. Cryptosporidiosis, Cryptococcus neoformans, and other toxoplasmosis. We don't have reagents to make the diagnosis. And we are a tertiary health institution. So how can you treat a patient empirically and for a tertiary health center for how long? What it means that if the patient recovers, then the diagnosis is right. If the patient does not recover, the diagnosis is wrong.
We came here, that was 3 days ago. And my brother fell sick, was ill. I took him to the first doctor, hospital at Uzakali, Tochi Hospital at Uzakali. And after everything, he was discharged, and we came back 2 days for him to go back to his destination. This sickness starts again. I arrived here, that was 3 days ago, and since we have arrived here, there are so many tests we're supposed to do, but we've not been, but it has not been done because of the system, the way things works here. Because some of the tests, as I'm talking to you now, since 3 days ago, I'm just getting some necessary tests we ought to do to help the whole situation. But I think that meeting you people will help us to see what to do, to make sure that he's alive. Because we are only two. And as you see him lying down here, he has 4 kids. 4 boys. You can see him lying critical. He can't talk, he can't walk. And I put everything in the hands of God. That's the only option.
The problem we have now is nutrition. Most of them, they don't have any support. Some of them, the family members have abandoned them. Some, they don't have any job doing. You know that one with this ailment needs good nutrition. So some find it difficult even to eat in a day.
You cannot reach them with motorcycle. You have to stop and then trek down the hill to such a far place. But for those that are accessible by road, yes, if you have a program, you have a team, like you said, the vehicle and with staff, and then some of these patients will not even give you their correct addresses. Because we've just done some contact tracking, and you find out that there's no such address. That was initially when there wasn't much awareness. People were trying to hide their identity. So people around them will not know that they have this sickness and that. But all that is gradually reducing now.